Okay, let's discuss the 5 transporting points. Yin spring points, SI2, the front body. Location on the ulnar aspect of the little finger distal to the metacarpophalangeal joint at the junction of the shaft and the base of the proximal phalanx. How to find an ulnar aspect of the little finger, palpate along the border of the red and white skin in the direction of the metacarpophalangeal joint until you can clearly feel the junction between the shaft and the base. SI2 is located at the junction of the shaft and the base and slightly inferior palmar to the exterior curvature of the bone. LI2 is located in a comparable position on the proximal phalanx of the index finger. In a comparable location on the foot are bladder 66 on the lateral aspect and spleen 2 on the medial aspect. Needling 0.2 to 0.52 obliquely in a proximal or distal direction and slightly towards the palm. Caution, painful point. Action indication, it drains heat, expels wind, disperses accumulations. Special features, it is a yin spring point, water point. Like all spring points, SI2 clears heat, both interior and exterior, can therefore be used to expel exterior wind heat, especially if it affects neck and eyes, and also to clear interior heat from the small intestine channel, but mostly in acute febrile disease. Owing to its relationship with the bladder within the greater yang, it can also be used to clear bladder heat when this causes burning and urination. It expels wind heat in mumps, aversion to cold, fever, febrile disease, cough. It also benefits the eyes, nose, and ears in blurred vision, high pain, red eyes, nasal congestion, nosebleed, tinnitus. It removes obstruction from the channel in stiff neck and upper back, pain in the scapula, pain in the arm, pain in the wrist, pain in the little finger. According to the classic of difficulties, yin spring points are indicated for heat in the body, and as the yin spring and water point of the small intestine fire channel, SI2 has a especially strong action on subduing fire. SI2 belongs to Tianchong channel, the most exterior of the 6 channel and able to clear heat, especially exterior wind heat from the superficial portion of the body, particularly in the eyes, nose, and ears. It's indicated for bursting eye pain, redness of the eyes, congested nose, nosebleed, and tinnitus. It is also able to clear exterior heat from the lungs and throat, cough, throat painful obstruction, fever, thirst, and to treat malaria. When heat pathogen is virulent, it may give rise to toxic heat characterized by inflammation, pain, and swelling. SI2 is indicated for mumps, swelling of the cheek radiating to the ears, and swelling and pain of the neck and throat. Finally, SI2 is indicated for stiffness and pain along the small intestine channel from the hand up to the neck, as well as for numbness and heat of the fingers and palms. Combination swelling of the throat with inability to swallow. SI2, kidney 6, liver 4, 1000 ducat formulas. Tired throat, swelling of the neck with inability to turn the head, swelling of the cheek that radiates to the ear. SI2, GB12, Sanjiao 16. Deafness, SI2, SI3, LI6, supplementing light. Tinnitus, SI2, LI6, LI5, LI1, bladder 8, SI4, supplementing light. Eye pain, SI2, LI5, LI2, PC7, LI3, DO23, rate compendium. Superficial visual obstruction, SI2, and bladder 64, 1000 ducat formulas. Malaria with chills and fever, SI2, lung 7, SI3, SI1, 1000 ducat formulas. Thank you for your attention.
Let's discuss pericardium 7, shoestring point. Pericardium 7 is located on the anterior aspect of the wrist joint space, most distal wrist crease, between the tendons of the palmaris longus and flexor carpi radialis muscles. How to find pericardium 7? As the location of the wrist crease varies, the wrist joint space is a more reliable reference point. By moving the patient's hand in a relaxed way, it can easily be palpated. Locate pericardium 7 on this level between the two tendons, which become more pronounced when the fingertips are pressed together. If only one tendon is visible, this will be the tendon of the flexor carpi radialis muscle. Pericardium 7 is located on its ulnar aspect. Located on the same level are heart 7 on the ulnar aspect of the wrist joint radial to the tendon of the flexor carpi ulnaris muscle, and lung 9 on the radial aspect of the wrist joint lateral to the radial artery. Needling is vertically 0.3 to 0.5 Tsun for carpal tunnel syndrome, also 0.5 to 1 Tsun obliquely in a lateral direction along the tunnel. Caution: the median nerve is located directly under this point. Thus, needling can cause a significant electric sensation. In this case, no further needle manipulation to avoid possible injury. Actions, indications: clears heat from the heart, calms the shen, harmonizes stomach and intestines, cools heart fire affecting the bladder, unbinds chest, cools the blood, opens the channel, alleviates pain. Special features: yuan source point, shoestring point, earth point, sedation point, sun si miao, ghost point, important point for calming, main point for carpal tunnel syndrome. Pericardium 7 is the shoestring, yuan source, and earth point of the pericardium channel. The classic of difficulty states: in cases of deficiency, reinforce the mother. In cases of excess, reduce the child. The pericardium channel belongs to fire, and as the earth or child point of a fire, the mother channel, pericardium 7 is able to reduce excess heat or fire from the pericardium. Pericardium is known as the wrapping of the heart, and like most points of the pericardium channel, pericardium 7 has a profound action on the heart and spirit. So close was the relationship between the pericardium and heart perceived to be that the spiritual pivot listed only 5 zan, omitting the pericardium entirely as a discrete zan, whilst describing the pericardium channel as the channel pertaining to the heart. Thus, for example, P7 rather than heart 7 was listed as the yuan source point of the heart. P7 is indicated in a wide variety of emotional disorders and is specially used whenever heat rises to disturb the spirit, whether due to excess of any of the 7 emotions, transforming into fire, stagnation of qi, which both impairs circulation of body fluids and transforms into fire, resulting in phlegm fire, which harasses the heart, febrile heat collapsing into the pericardium, blazing heat arising from deficiency of yin. When the spirit is disrupted in this way, it will give rise to palpitations, agitation, epilepsy, mania, manic raving, restlessness, insomnia, and anxiety. Under its alternative name, ghost heart, P7 was included by Sun Si Miao among his 13 ghost points for the treatment of mania disorder and epilepsy. The relationship of excessive laughter to heart fire has long been recognized. For example, Kong Tianshan in Achieving Longevity by Guarding the Source stated, ceaseless laughter is due to blazing of heart fire. However, as long ago as the Yellow Emperor's Inner Classic, it was recognized that extravagant joy and deep sadness were equally manifestations of a disordered heart spirit. Thus, the spiritual pivot says, the heart rules the vessels are residents of the spirit. When heart chi is deficient, there is sadness. When excess, there is ceaseless laughter. Whilst the essential question states, the heart stores the spirit. When the spirit is in excess, there is ceaseless laughter. When the spirit is insufficient, there is sadness. The fact that P7 is indicated not only for ceaseless laughter, but also for sadness and weeping with grief reflects its application in both excess and deficiency disorders of the spirit. If heart fire transmits to its interiorly-exteriorly coupled SI channel, and from the SI the hand Taiyang channel to the bladder foot Taiyang channel, and then to the bladder fu, there may be difficult and bloody urination, both indications for this point. The pericardium is interiorly, exteriorly coupled with the Sanjiao channel, whilst the interior pathway of the pericardium primary and divergent channels pass through the middle and lower jaw. P7, therefore, like many points of the pericardium channel, is used to harmonize stomach and intestines, especially when fire causes stomach qi to rebel upwards, with symptoms such as foul breath, epigastric pain, vomiting of blood, and sudden turmoil disorder. The pericardium hand-Yin channel and its coupled liver foot-Yin channel are said to share the same qi. This has special significance in relation to the actions of P7 in clearing heat from the heart, calming the spirit, and harmonizing stomach and intestines. Liver qi stagnation may either transform to fire and rise to disturb the heart and spirit, or transversely invade the stomach, causing stomach qi to rebel upwards. As a result of the primary focus of P7 on the upper jaw, its special relationship to the liver, and the pathway of the pericardium sinew channel to the anterior ribs, P7 is also used to unbind the qi of the chest and treat fullness of the chest, shortness of breath, pain of the chest and lateral costal region, sighing, and breast pain. In common with several other points of the channel, P7 is indicated when febrile disease penetrates to the nutritive and especially the blood levels, agitating the pericardium and spirit, and giving rise to fever with agitation, cracked tongue, insomnia, and even mania. This action of P7 on cooling the blood level further explains its use in treatment of eczema, wind rash, and carbuncles and furuncles. Finally, P7 is the principal point used in the treatment of carpal tunnel syndrome, in which case the needle is inserted obliquely and distally along the carpal tunnel. Thank you for your attention.
Let's discuss the extra points. Baxie, 8 pathogens, and the Sifeng, 4 seams. Location slightly proximal to the margins of the web between the fingers on the border of the red and white skin. How to find? These points are best located when a loose face is made. Locate the points on the border between the red and white. PB2 between the 4th and 5th finger is a point of EXUE9. The points of the EXLE10 Baxie are located in comparable position on the foot proximal to the margins of the webs between the toes. Liver 2, stomach 44, GB43 are all part of the EXLE10. Needling up to 1 tube parallel to the metacarpal bones. Action indication clears heat, expels cold, and dampness. Location on the dorsum of the hand on the webs between the 5 fingers of both hands. When one hand is made into a fist, 3 of these points are in the depression between the metacarpal hands proximal to the web margins. The other point is equidistant between the thumb and index metacarpal proximal to the web margins. So here is the illustration of a Baxie. For the action, it relaxes the sinews, expels with dampness. For the indication, numbness, stiffness, redness, swelling, spasm, and pain of the fingers. Painful obstruction syndrome, B syndrome of the fingers. These points are very frequently used for painful obstruction syndrome of the hand and fingers. They eliminate wind and damp and relaxes the tendons. They also move blood in the hand and fingers and are therefore used for chronic atrophy syndrome of the hands. Relaxes the sinews, expels wind, dampness, numbness, stiffness, redness, swelling, spasm, and pain of the fingers. Painful obstruction syndrome, B syndrome of the fingers. These points were first discussed as far as the as far back as the essential questions which recommended bleeding them for the treatment of malaria. The name Baxie, 8 pathogens, however, did not appear until the Great Compendium of Acupuncture and Maximation. Modern clinical practice, they are almost always used for treating pain, swelling, stiffness, numbness, or spasm on the fingers and surrounding area. For disorders of the ring, middle, and index. Fingers, the points either side of the finger are generally needled. For disorders of the little finger, the point between the little and the ring finger is needled in combination with points such as SI2, SI3. For disorders of the thumb, the point between the thumb and index finger is needled in combination with points such as lung 7 and lung 10. For same location, on the palmar aspect of the second to fifth fingers at the midpoint of the transverse crest of the proximal interphalangeal joints. How to find, locate the points on the palmar aspect of the second to fifth fingers at the midpoint of the transverse crest of the proximal interphalangeal joints. Locate in a similar position on the dorsal aspect of the little and middle finger, EXUE6 and EXUE4 respectively. Needling, prick to bleed. Actions indications harmonizes the chi flow between the upper and middle burner. Sifeng for crux. Location on the palmar surface in the transverse creases of the proximal interphalangeal joints of the 4 fingers, including the thumb. Action resolves dampness and foot retention in children. So we have here the illustration. Shipping, Sichuan. Indication, childhood nutritional impairment, accumulation disorder in children, food retention, poor digestion, diarrhea. These points are mostly used in young children to promote digestion. The points should be needled and then a yellow fluid extracted from them. However, they are effective also if there is no yellow fluid coming out. It resolves dampness and food retention in children, childhood nutritional impairment, accumulation disorder in children, food retention, poor digestion, diarrhea. Sifeng is an important and commonly used point grouping in the treatment of a wide range of childhood digestive disorder. It is indicated for 2 important patterns known as childhood nutritional impairment. In childhood accumulation disorder, okay, the former refers to childhood nutritional due to a variety of etiologies. Its symptoms include emaciation, sallow complexion, impaired digestion, withered hair, exhaustion, and large abdomen. The latter, childhood accumulation disorder, more or less corresponds to the pattern of food stagnation in adults and is regarded as a major factor in such various diseases as constipation, abdominal pain, intestinal parasites, vomiting, diarrhea, cough, and asthma. The needling method used at these points very specific. The points being pricked and squeezed to express a few drops of clear yellow fluid. Thank you for your attention.
Let's now discuss Heart 4, a Jing River point. Heart 4 is located 1.5 Sun, proximal to the transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. How to find? The flexor carpi radialis muscle is a distinct tendon which can be easily palpated ulnar and proximal to the wrist crease. It attaches to the pisiform bone. Heart 4 is located directly on the radial side of the tendon. Heart 5, Heart 6, and Heart 7 are located at 0.5 Sun intervals distal to Heart 4. Lung 7 is located approximately 1.5 Sun proximal to the wrist crease on the radial aspect of the forearm. Needling 0.3 to 1 Sun vertically or obliquely in a proximal or distal direction. Actions, indications. HT4 opens the channel, nourishes the heart, calms the shen, strengthens the voice. Special features, Jing River point, metal point. This point is mostly used in channel problems, also because as a river point, it has a special action on joints and bones. It is therefore used for spasm and neuralgia of the forearm and painful obstruction syndrome or P syndrome of elbow and wrist, if the obstruction is along the heart and small intestine channels. As it subdues rebellious qi, HT4 can also be used for nausea, as this symptom is often related to ascending of heart qi rather than stomach qi. Calms the mind, so it's good for sadness, fear, anxiety, mental restlessness. Subdues rebellious qi for retching, redness, and swelling of the eyes. Relaxes the sinews for contraction of elbow and arm. HT4, as its name spirit path implies, has the ability to calm the spirit and is indicated for restless Zhang disorder and sadness and fear. Restless Zhang disorder arises due to overthinking, excessive worry, and anxiety, which injure the heart, spleen, and liver. It is characterized by a wide variety of symptoms, including unpredictable emotional responses, melancholy, disturbed behavior, restlessness, insomnia, loss of voice, and even mania. In terms of modern medicine, it corresponds to hysterical neurosis. The ability of HT4 to treat sudden loss of voice reflects its status as a Jing River point, since the spiritual pivot states that the Jing River points should be needled for changes manifesting in the patient's voice. According to the spiritual pivot, when the disease is at the yin within yang, the sinews and bones, needle the Jing River point of the yin. HT4, the Jing River point of the heart channel, is indicated for contraction of the elbow and arm and a freezing cold sensation deep within the marrow and bones. The spirit in this context refers to the Ling spirit, hidden, serene, mysterious, receptive, as in HT2. The metal should be the temperature of the earth. If it is too cold, it may result in physical rigidity, arthritis of the elbow or wrist, or an inability to bend the arm, the hands and wrists. If it is too hot, it may manifest as cardiac pain or palpitations. Consider using this point if the spirit is weakened or broken, or when a patient is sad or miserable. For loss of inner direction and purpose in life, reconnects us with the Father and lends structure, useful with HT7 to help encourage the patient back on their harmonious path or way of the Tao. The heart houses the Shen, and here is the pathway to the spirit. In the upper jiao, the heart and lungs work so closely together, a sovereign and prime minister among the officials. If one is affected, so often is the other. Here, spirit path brings the resonance of metal to the heart meridian. Connection to the heavens, structure, clarity, and the pose, automatic rhythmic maintenance of all our functions and instincts, mostly unthought of unless they go wrong, can all be accessed here within the context of the heart. When a person's spirit is failing, this point contacts the Shen to put the person back in touch with greater consciousness and the authenticity of their being. Used when they lack consistency or structure. If the heart has been disrespected or knocked from its position or has lost its natural rhythm, then the responses of the heart can become deviated and corrupted. The guidance from the spirits is lost and the person dissembles. HT4, we use it to restore regularity and rhythm. If elation has got out of hand and become exhausting to the heart, then the movement of metal, of returning to the inside, setting limits and infusing inspiration and richness can help return the heart to its proper pattern of expression. If the heart is oppressed and not maintaining its natural rhythms and instincts, its emanations will not circulate freely, whether the cause is deep sadness and distress or blood deficiency. The resonance of the lung at HT4, the controller of the breaths and the strength and rhythm, can help free this oppression of the heart. HT4 regulates the heart, calms the spirit for hysteria, restlessness, fear and melancholia, incoherent thinking or speech. The heart as supreme controller must be maintained on the path of the spirit. It can be used with HT7, spirit gate, to reinforce the movement of qi along the meridian. Removes obstruction from the meridian, local for contracture of the elbow and arm. As a Jing River point, it has an effect on joints and bones, flushing qi through them, and can be used for spasm of the forearm and arthritis of elbow and wrist. At Jing River points, the qi moves like a wide, mighty river. Jing River points are recommended for respiratory illness and, in this case, for sudden loss of voice, especially from an emotional cause. Thank you for listening.
Let's discuss the stomach channel points overview, part 2. Specific points according to the channel pathway in numerical order. SI1, meeting point with the Renmai, Yangqiao Mai, Dumai, local point for the eyes. Stomach 2, meeting point with the Yangqiao Mai, adjacent point for the eyes. Stomach 3, meeting point for the Yangqiao Mai. Stomach 4, meeting point with the large intestine channel, Yangqiao Mai, Dumai, Renmai, local point for the mouth teeth. Stomach 5, meeting point with the gallbladder channel. Stomach 6, Sun Si Miao ghost point, meeting point with the gallbladder channel, local point for the mouth teeth. SI7, meeting point with the gallbladder channel, adjacent point for the teeth and jaw, local point for the jaw. Stomach 8, meeting point with the gallbladder channel, Yang Mi Mai, adjacent point for the frontal headaches. Stomach 9, meeting point with the gallbladder channel, C of Chi point, window of heaven point. Stomach 10, adjacent point for the neck. Stomach 12, meeting point with the LISITB and gallbladder channels. SI21, adjacent point for the spleen, stomach, and gallbladder. Stomach 25, front move point of the large intestine, adjacent point for the abdominal region. Stomach 26, adjacent point for the abdominal region. Stomach 28, local point for the small intestine and bladder. Stomach 29, local point for the urogenital region. Stomach 30, meeting point with the Chongmai GB channel. C of water and brain point, local point for the urogenital region, adjacent point for the abdominal region. Stomach 34, C-clef point, important adjacent point for disorders of the knee. Stomach 35, local point for the knee region. Stomach 36, SC point, earth, bed point, 5 face point, lower SC point in the stomach, Gawu Kopan point for the abdomen, sea of water and brain point, Ba Dan Yang heavenly star point, distal point for the spleen, stomach, and epigastrium, local point for the knee, distal point for the shoulder, adjacent point for the foot. Stomach 37, lower SC point of the large intestine, sea of blood point, distal point for the large intestine. Stomach 38, distal point for the shoulder region. Stomach 39, lower SC point for the small intestine, sea of blood point, distal point for the small intestine. Stomach 40, Lu connecting point, main phlegm point, distal point of the lungs. Stomach 41, Jing River point, fire, tonification point, local point for the foot, adjacent point for the toes. Stomach 42, Yuan source point. Stomach 43, Shu street point, wood. Stomach 44, Ying spring point, water. Distal point for frontal headaches as well as for the nose, mouth, teeth, and throat. Madanyang heavenly star point. Stomach 45, Jing well point, metal, sedation point. General location Okay, location health. SI stomach 1 to stomach 4 with the patient looking straight ahead. These points are located on the vertical pupil line. Stomach 12 to stomach 18 are all located in the mid-clavicular mammillary line or tuned lateral to the anterior midline. Stomach 12 in the supraclavicular fossa. Stomach 13 on the lower border of the clavicle. Stomach 14 to stomach 18 in the first to fifth intercostal spaces. Stomach 19 to stomach 30 are all located on a vertical line midway between the mammillary line and the anterior midline to tune lateral to the anterior midline. Stomach 19, stomach 25 are located on the A-tune section between the intercostal angle and the umbilicus. Stomach 19 to stomach 25 are evenly spread on this line. From 6 tune above the umbilicus to the same level as the umbilicus. Stomach 26 to stomach 30 are located on the 5th tune section between the umbilicus and the upper border of the pubic symphysis. 1 tune steps from 4 tune superior to the upper border of the pubic symphysis to its upper border. Thank you for your attention.
Now let's go to the lumbar spine for location methods and tune measurements. Iliac crest, Taffier's line. The iliac crests and the associated Taffier's line are major reference points in the lumbar region. The Taffier's line is located by palpating along the iliac crests from the center in a lateral direction until their highest points are reached. The Taffier's line is an imaginary horizontal line connecting those 2 points. The junction of this line with the spine generally marks the level of the spinous process of lumbar 4. For a quick location in clinical practice, both hands are placed directly, superiorly, or laterally to the highest points of the iliac crests. Then the thumbs are joined in the center above the lumbar spine. However, it should be noted that layers of muscle and skin between the crests and the practitioner's hands may shift the Taffier's line in a cranial direction. Caution: the position of the patient, standing, sitting, prone, as well as the individual anatomy of the pelvis and lumbar spine can significantly influence the level of the lumbar vertebrae in relation to the pelvis. Thus, the Taffier's line will cross the spine at varying levels depending on whether the patient is sitting or in a prone position, or if a standing patient presents with hyperlordosis of the lumbar spine and pelvic antiflexion, or with hypolordosis of the lumbar spine, pelvic retroflexion, and shortened ischiocrural musculature. Hossbach from University of Bochum, Germany, investigated the effect of a prone position, as common in acupuncture treatments, on the level of the Taffier's line in relation to the lumbar spine. It seems that in this position, the line moves further down the spine to the level of the upper border of lumbar 5, or the space between L4 and L5. However, the low number of cases studied does not merit a conclusive evaluation. To ensure the proper identification of L4, it is always recommended to use additional points of reference, such as the space between L5 and the sacrum, or the lumbosacral joint. Now let's talk about the lumbosacral junction. Following orientation in the lumbar region with the help of the iliac crests, the lumbosacral joint can be located by counting the spinous processes in an inferior direction. It can generally be felt as a marked kink or depression, followed by the smaller spinous processes of the slightly convex median sacral crest directly below. Caution: note that according to the literature, in up to 15% of cases, there can be lumbarization of the first sacral vertebra or sacralization of L5. In these cases, there will be either 4 or 6 lumbar vertebrae. Posterior superior iliac spine, PCS. Another important landmark on the lower back is the posterior superior iliac spine, which forms the posterior end of the iliac crest lateral to the upper sacral region. The PCs can often be identified by two superficially visible dimples. It is best located by palpating from an inferior in a superior direction. If the dimples are not visible, they can be located by palpating 3-tsun from the rima ani in a superior and lateral direction at an angle of 45 degrees until a marked bony ridge can be felt. Generally, the PCs is located at the level of the space between the first and second sacral foramina, so that bladder 27 is located directly medial or slightly superior and medial to the PCs, while bladder 28 is located just inferior and medial to the PCs. Thank you for your attention.
Let's continue with the window of heaven points. GB9 heavenly rushing. Location 1.5 June directly superior to the apex of the ear. GB20 and 0.5 June posterior to GB8. The point approximately superior to the posterior margin of the ear. To find, first locate GB8 1.5 June superior to the apex of the ear. The latter becomes more clearly defined by folding the auricle towards the anterior so that the posterior part of the upper helix covers its anterior part. From GB8 measures 0.5 June in a posterior direction and therefore locate GB9 similar to GB8. GB9 is located in a slight dip in the bone. Both GB9 and GB12 in the depression posterior and inferior to the masted process are reference point for a curved line that runs approximately parallel to the posterior margin of the ear within the hairline. When dividing this line into thirds, GB10, GB11 are located at the junctions of the thirds. It link 0.5 to 1.5 June transversely, subcutaneously towards the occiput on or the site of the pain. Action indication, it expels wind and heat, opens the loop connecting vessels, comes the shed. Special features, meeting point with bladder channel, window of heaven point according to some authors. GB9 is a very important local point of the gallbladder channel. First of all, it is very much used as a local point for migraine headaches on the side of the head from rising of liver yang, liver fire, or liver wind. This point helps to subdue the rising of rebellious chi and conducts it downward. Another important function of this point is that of eliminating interior wind and its manifestation, especially convulsion, epilepsy, or contraction of muscles. GB9 has a powerful mental effect and is used to calm the mind. In serious mental disorders such as hypomania, it is an important adjuvant to the treatment with distal points. This point is also used for disturbance movement, such as ataxia and speech originating from central nervous system disease. When used in this way, it is combined with GB5, LI11, and GB34. It is interesting to note that, judging from the name and indications, this point should be a window of heaven point, but it is not mentioned as one. Its action include two important actions of the window of heaven points, that is subduing rebellious chi from the head and calming the mind. Subdues liver yang in headache, tinnitus, dizziness. Extinguishes interior wind in epilepsy, tetany, convulsions. Calms the mind in fright, fear, palpitation, manic behavior, and also resolves numbness and clears heat in the head, in itchy ears, toothache, swelling, and pain of the gums, goiter. Chapter 21 of the Spiritual Pivot lists 5 points known as the points of the window of heaven stomach 9, LI 18, Sanjiao 16, bladder 10, lung 3. Chapter 2 of the same text gives an unnamed list of 10 points, which includes the 5 window of heaven points, and adds the points red 22, SI16, SI17, Do 16, P1. This passage first discusses rank 22 and then the 6 young channel points as a sequence of vertical lines spreading from the conception vessel and ending with Qiangu. Do 16 on the governing vessel with lung 3 and P1 as additional points. Later commentators, particularly Ma Shi, the great physician of the Ming Dynasty, an expert on the Yellow Emperor Inner Classic, pointed out that this passage discusses SI17 as a point of Xiaoyang channel, whereas in fact it is a point of the Hantai Yang channel. They therefore suggested that SI17 should in fact be GB9. If so, all the 6 young channels would then be represented. These 10 points have certain common properties being indicated especially for disharmony between the head and body. Disorders of the head and sense organ, goiter, scrupula, rebellion of the lung and stomach chi, and emotional disorders. Many classics indicate GB9 for a variety of mental and psychological diseases characterized by propensity to fear and pride palpitations, epilepsy, madness, etc. According to modern acupuncture research in psychiatric hospitals, many head points are effective in treating disorder of the underlying portion of the brain, and this may help explain these traditional indications. Thank you for your attention.
We continue discussing influenza A as part of our common cold and influenza heading. An influenza epidemic definitely manifests with symptoms of wind heat in all cases. The most important thing to establish when we see a patient suffering from an acute respiratory infection is whether the stage of the condition is external or internal. That is, whether the pathogenic factor is still on the exterior or is in the interior. In terms of levels, this means distinguishing whether the patient is still at the Wei level or at the Qi level. The differentiation between the Wei and the Qi level is relatively easy. If the patient suffers from aversion to cold, he or she is still at the Wei level. If he does not suffer from aversion to cold, but on the contrary, from aversion to heat, the patient is at the Qi level. Thus, influenza will always start with manifestations similar to Wei Qi level of the 4 levels. If the pathogenic factor is not expelled at the beginning stages, it will penetrate into the interior and thus become interior heat. Once the pathogenic factor penetrates into the interior, the body's Qi carries on its fight against it in the interior. This causes a high fever and a feeling of heat, in marked contrast to the aversion to cold and the shivering which occur when the body's Qi fights the pathogenic factor on the exterior. At the exterior level, the internal organs are not affected, and it is only the lungs' Wei Qi portion which is involved. When the pathogenic factor moves to the interior, the organs are affected, especially the lungs and stomach. This stage of development in the pathology of these diseases is crucial, as if the pathogenic factor is not cleared, it may either penetrate more deeply and cause serious problems at the yin qi or blood level, or give rise to residual heat, which is often the cause of chronic post-viral fatigue syndromes. In the interior, the main patterns appearing will be one of the Qi level patterns within the 4 levels. In general, at the Qi level, either the stomach or lung or both are affected. Expel wind heat. Invasions of wind heat manifest with aversion to cold, fever, thirst, sore throat, body aches, headache, tonsillitis, ear infection, cough, floating rapid pulse, and tongue red on the sides. Points, lung 7, Li4, TB5, DO14, Li11, lung 11 in case of tonsillitis, bladder 12 with cupping, bladder 13. The simplest and clearest sign that the invasion of wind is moved from the exterior or way level to the interior or chi level is that the patient no longer feels cold and does not shiver but feels hot and thirsty. The most common patterns at this level are either lung heat or lung phlegm heat, so that the patient develops bronchitis or pneumonia. Lung 7, lung 10, DO14, Li11, lung 5, bladder 13, and lung 1. The cough following a cold or flu, expectoration of profuse sticky yellow sputum, slight breathlessness, a feeling of oppression of the chest, possibly fever, thirst, disturbed sleep, full slippery pulse, red tongue with sticky yellow coating. So we use the points lung 7, lung 10, DO14, Li11, lung 5, bladder 13, lung 1, Ren 12, Ren 9, stomach 40. Now, to strengthen the immunity and resistance to viruses and bacteria, we tonify the lung and kidney qi. So we use lung 7, lung 9, bladder 13, DO12, Ren 12, Ren 4, kidney 3, and bladder 23. Thank you, everyone, for your attention.